Thank you, Mr. Speaker. I rise to speak on behalf of the Greens on the Public Health Amendment Safe Access and Reproductive Health Clinics Bill 2018 and express the Greens' support for this bill. I would like to acknowledge the member for Port Macquarie for introducing the bill to this place, and it is absolutely true when she said that today is the day to protect women in New South Wales. While I might have very strong views and the Greens may have very strong views on what we should be doing about abortion law reform in this state, about protecting human rights and women's rights, it is absolutely true that the bill before us today is a simple one about providing women the ability to access health clinics, abortion clinics, to the right to safe and accessible health expertise without being harassed or intimidated or bullied. It is absolutely clear that that is what this bill is about, and I would urge all members that are listening closely and contemplating their decision on this to know that that is what this bill is about. It is about making sure that women are not faced with harassment and intimidation when they go and do some of the most personal things that you could ever imagine having to do in relation to this. And I wanted to let members know a situation that happened to me as a result of being pregnant recently and finding myself in our local public hospital. It is a fairly confronting thing to be a local member where people know who you are, and to be engaging with the reality of being pregnant and having contractions in a public hospital when people know you are the local member. And that was an incredibly joyous time, a little traumatic and a little bit intense. It was a 5-day labour. It wasn't the most pleasant of experiences I've ever had. But the reason I share that is because I know that in that situation, that was an incredibly positive experience. That was an incredibly wonderful experience to me. The confronting reality of having people know what was happening to me in a very private and intimate time, even though it was a joyous time, was really confronting. And I say that because I have had the other option. I have had the other experience as well, and I have had to engage with other decisions around having a termination. And I say that because I know that those decisions are decisions that women make with a whole lot of personal consideration, with a whole lot of discussions with the people that are closest to them, and with medical experts, and with people that are advising them and supporting them. The idea that a woman makes that decision, whether it be to seek guidance and support in a women's health clinic to be able to have a child or to have a termination, the idea that any individual thinks that it is appropriate or okay to be able to harass and intimidate a woman and their support people as they are walking into those clinics, or the professionals that work in those clinics, is just completely unacceptable. That is what we are discussing today, and that is what we are seeking to do, is to provide a level of support and protection to those women, to their families, to their support people, and to the people that work in those clinics, so that they do not face that harassment, so that they do not face that intimidation. We as MPs face harassment and intimidation sometimes as we walk into this place, and the right to freedom of protest, to peaceful assembly, is something that I will always protect. But there is no right in any United Nations convention that enshrines the right to harass women. There is absolutely no right that enshrines a right to be able to intimidate women. I encourage any members that are speaking against this bill to bring in that, the details of that United Nations Convention or Covenant that may set out the right to harass or intimidate women, because I would be interested to hear. As we have heard, the substance of this bill creates offences for the following actions within the 150-metre safe access zones: for interfering with access of persons to reproductive health clinics, obstructing or block a footpath or road leading to any reproductive health clinic, making a communication that relates to abortions that is reasonably likely to cause distress or anxiety, and capturing and distributing visual data of persons without their consent. It's pretty clear that all of those acts would be abhorrent. It's pretty clear that those acts should be punished, and it's pretty clear that women should be able to be free from that kind of harassment and intimidation. The Newtown electorate includes, it did include a number of clinics, but it includes one particular clinic on Devonshire Street that has been the focus of much discussion. I wanted to mention specifically that clinic because it is not just the women and the support people entering that clinic that experience that harassment and intimidation. Devonshire Street, when it's not being a focus of large amounts of light rail construction, is a busy thoroughfare for many people in Surrey Hills walking to Central Station. The trauma that is inflicted on local residents that are going about their daily commute to have to walk past the images and the visuals and the attempts at I don't even know what the attempts are, but the really intimidatory practices that occur on that street goes well beyond just the people accessing the clinic. It is truly confronting for so many people, and the harm caused to so many is not acceptable. The other thing that we know, and I use the example of Richard from Redfern, who wrote as one of the constituents in support of this bill to me, saying that I work on Devonshire Street and these people always block the footpath and are rude and aggressive. This is a man who works on Devonshire Street. He's not a woman who is making a really full-on decision about the needs for accessing reproductive health, and he's feeling that these are not acceptable actions. So the idea of how it impacts, and we've heard from some of the other members giving examples of the impacts on women and the impact that this kind of harassment and intimidation has. It's clear from what we are debating here in relation to this bill that there have been many organisations and groups and people consulted. Fair Agenda, the Country Women's Association, Get Up, Human Rights Law Centre, the Women's Electoral Lobby, the AMA in New South Wales, the Community Legal Centre's peak body, are all in support of introducing the safe access zones. I could go on and the list is much larger. We also know that this has been the culmination of a number of different campaigns and work to be able to put the issue of women's access to safe reproductive choices on the agenda. I acknowledge that Penny Sharp and Trevor Khan have been in here for parts of the debate, and I acknowledge my Greens colleague, Marine Faruqi, who introduced a bill into the other place to be able to remove abortion from the Crimes Act to push the debate and agenda about women's access to safe reproductive choices in New South Wales. But I also just want to urge everybody here to realise what it is we are thinking about and what it is we are considering. What we are saying here is that the women that are accessing reproductive health clinics, the women that are accessing women's health clinics and abortion clinics, are able to do so without harassment and intimidation and fear. That is what this bill is about. That is what we are saying here. And that is what we should be doing as members of Parliament, because if we cannot pass legislation to protect women to be free from harassment and intimidation when they access safe, legal health clinics where professionals work to provide them with that advice, then what are we doing here? Like, really, what are we doing here if we cannot provide those protections? I want to conclude by reminding people that last year there was unanimous support in this chamber for a notice of motion that I put before this House that recognised that we support the right for women to make the choice that is right for them, which includes respecting their right to access safe and legal abortion. That motion passed through this chamber. It passed without dissent, and it passed with the support of everybody in this place. I appreciate that individual members, and I said that at the time, individual members may choose to not want to access a termination or an abortion. But that is their individual choice. It is for us in this place to respect the fact that it is a woman's right to choose what is best for her interests and for her health. It is a woman's right to be able to seek access to professional health advice in relation to the reproductive choices that she wishes to make. And by passing this bill today, what we are doing is saying that not only does a woman have a right to access those safe reproductive choices, but that she has a right to do it without harassment, bullying, intimidation or fear. She has a right to be able to do it in a way that is safe to her and does not cause more harm to her at a time where she is doing probably some of the most difficult things that she could ever do. I urge all members to recognise that that is all that this bill is. This is not anything else. It is us saying that we will protect women in New South Wales to make sure that they are able to live free from harassment and intimidation. I commend the bill to the House.